The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Hi. Happy Wednesday. We're back again with episode 17. And per our usual, we're going to start with some jokes.
Okay. This one's not like kid related at all, but it's so dumb. I love it. It was, what kind of canoes are the worst kind of canoes? It's volcanoes. But like you don't, it's weird when you say it out loud, but when you read it as volcanoes.
Volcano.
I have another one, real quick. Why did the tomato turn red? Because he saw the salad dressing.
Oh.
Okay.
He's a shy tomato. An innocent tomato. Okay, so how do you make a tissue dance?
I don't know.
You put a little boogie in it.
Ew.
That's one for the
That's
kids.
funny.
And obviously me, I laughed.
I think they're always funny. They just crack me up.
So today we are going to talk about herbal supplements. And
Yes.
specifically the ones that we don't want to use
Yes.
during pregnancy.
So obviously, consult your healthcare provider, your OB, your pediatrician, whoever. Consult your doctor before starting, or even if you've already been taking these supplements and you need to get some feedback, please contact your healthcare provider for anything at all. Any of your general medications, obviously, but if you're starting anything new. My biggest thing with this particular topic is that natural is not always the safest. Most importantly, because these things are advertised as, of course, organic. It comes from the earth. It can't be bad for us, but they can cause severe reactions if you've not spoken to a healthcare provider, not done any research, etc. So natural is not always a safer option.
No, and actually, as I was looking through these today, it seems like the ones that are really natural, the plant ones,
The plant-based ones.
I think they're more dangerous than the ones that aren't. At least the ones we're going to talk about today.
And there's just so many different types of supplements on the market these days, like whether they're hormone regulating, whether they're mood boosting, whether it's just a simple little tea that may help with your skin, things like that. Just be very careful. If you're going to buy something new, look at your ingredients, talk to your doctor, go through the basic steps, because it may not be good for you. It may be okay in your first trimester and not good in your third trimester. Or it may not be good for breastfeeding. And
there were even some that said you shouldn't take it right before your pregnancy even.
Yes.
So
there's just some wild things out there that you wouldn't think, that does that. So,
yeah.
And again, these types of things, these supplements, are not necessarily, they're not regulated by the FDA. So you could be ordering something from the store, Amazon, and it could say one thing, and they could have easily put in different other ingredients to kind of fortify that, if you will, but you don't know that for sure. Not only that is, you don't know exactly what concentration you get, because not every plant is the same. Like if they're harvesting these things, turning them into supplements, you don't know which ones were more potent and which ones aren't going to be as potent. So therefore, there's not a lot of studies done on these types of supplements, just because there's no regulation on them. So we have a list of kind of like, there's a bunch of them out there, but we kind of have compiled the list of your ones that are common that you really want to watch out for. Okay. So this one actually got me, because I was like, oh, I really didn't know this. And some people do. Some people already know, but I had no idea. And it's not a supplement necessarily, but it's an easy purchase. But it's the high dose vitamin A. So your retinol face creams, retinol based face creams, those are very toxic to your baby. They can cause birth defects.
No clue. I would not have thought anything about using that.
Me neither.
I use a retinol cream every night.
Me too.
I would not have thought about that.
Me neither. So when I looked that up, because it's a high dose vitamin A, now granted, like, you are putting it on your skin. You're not ingesting it. But remember, like, anything you do put on your skin will be absorbed into your system at some point in time.
Your skin is your largest organ.
Yeah, so it's going to be, whether it's like a gradual absorption and you just kind of accumulate this high dose of vitamin A or retinol over time, it still could cause damaging effects to your kiddo. So, and this is one I read too, liver and liver products.
Yes.
Whether you're eating them or the supplements, they do have like organ supplements for things like this. They do contain a large amount of vitamin A. So,
And other foods that do contain vitamin A are your leafy greens, your orange and yellow vegetables and fruits, red bell peppers, dairy egg yolks.
Yeah.
Which, you really can't overdo those in the food. But if you're taking the supplement on top of it, you might be able to exceed that.
You just, so hard to say.
Your recommended dose, like the average adult, is 5,000 to 8,000 international units daily. That excessive dose is what they call excessive, is 25,000. So, and some people really, there's a mentality that I think a lot of people just think, if one's good for you, two's going to be even better.
Yeah.
So
take a couple of those.
That's where you may run into trouble, if you eat a lot of eggs or, veggies, and then you're taking 2 vitamin A supplements on top of it and using your retinol.
I was going to say, putting some
night.
cream on your face at night. Yes. So just be cognizant of that. Talk to your doctor about certain things.
So the harm there is that it can cause birth defects, particularly vision problems.
Yes.
Which is one thing that the the vitamin A helps with in your vision. But
when you're taking it as a supplement, great.
Too much is not a good thing.
Not a good thing.
Does the opposite.
And this one, I never put it together either, but your high doses of like vitamin E and vitamin D, so those are good for your clotting factors, your coagulation, your, helps
immune health, muscles, and brain cells.
If you take too much of that, it can cause an abruption, which is significant bleeding from your uterus. So we'll just shorten that.
Placenta separates from the uterine wall, and it's bad news.
Dangerous outcomes usually there. So, which, high doses of vitamin E or vitamin D can cause abruptions. So, we normally like our vitamins. We, try to take them, try to be healthy. But if we're taking an excessive amount, it can have some detrimental side effects. So,
Yep. We got to be careful of those. Those were the ones that really shocked me. And then looking at the rest, I know I've saw Palmetto in like the Vitaminol at the store. Didn't know what it was, but I see it all the time.
Yep. Saw Palmetto. It's supposed to help with your hair, skin health. It's good for regulating hormones. I think it's a lot of male supplements as well. But it is completely unsafe for pregnancy and breastfeeding. It disrupts the hormones and sometimes can cause high blood pressures. So high blood pressure in pregnancy, that's a no bueno. So that's not good for you or your baby there. But and if we're mispronouncing these guys, sorry.
It's because we don't use them.
Yeah, we don't use them. Don't yell at us. Like, some of them are basic, but
that's what they'll say about us. They're so basic.
Sorry, not sorry. Excuse me, I like my pumpkin spice latte. Okay.
Oh my gosh. So golden seal?
Golden seal. I've actually seen this one in teas and such. Yeah, like my husband likes to drink tea. I like to drink tea, but they have it in teas. respiratory tract. And they don't always advertise. It could be like respiratory health tea when you got to look at the ingredients. Oh, it's got golden seal. That can help my common cold and anti-inflammatory. However,
it sounds like it would be good.
Sounds like it would be good. However, it can get to the fetus and then later on cause issues with jaundice and high bilirubin, which can, if not treated in time or not treated well, can lead to kernicterus, which is a really devastating effect on the brain. So
yes. Yeah, that's scary.
Yeah.
And it also says it can stimulate uterine contractions.
Yeah, I feel like a lot of these do that.
Yeah.
A lot of these supplements
I did notice that. So, they
either disrupt your hormones or
early
can cause
pregnancy can be very bad.
Or can cause some sort of contractions. So, anyway.
Okay.
Next one.
Passion flower.
That's in a lot of things too. Again, your teas. I think it's in some calming things. So that's used as like a GABA transmitter, neurotransmitter. It's for like helping sleep, decrease anxiety, decrease anxiety. Overall, just kind of help promote relaxation. So we'd normally want that, yeah. Except that it can induce labor.
Yes.
So maybe not if you're kind of in your preterm, early stages. It can cause contractions and induce labor. Has the potential to do that.
May decrease your anxiety temporarily, but
then when you start laboring,
really get anxious.
Yes.
It's going to backfire.
Yeah.
Valerian root. That's another one I've seen and heard. So I guess a lot of people use that for sleep, anxiety, and did not know this, ADHD. So it comes in several forms: capsules, tablets, teas, extracts. Lots of different ways you can.
I've used this one
that
before,
one?
and I think they actually put it also in like pet supplements for calming pet supplements.
Oh,
Anyway,
really?
regardless. But yes, it can have cytotoxic effects on the fetus and cause delayed development.
And when I hear cytotoxic, what's the big thing you think about it? Chemotherapy drugs.
Yes, that's what I think too.
I'm like, ugh. I don't think I would
That
want to take
doesn't sound good.
No, it doesn't.
I don't want that for my fetus.
It
my unborn child.
something that kills cells.
Yeah.
No,
we don't-
let's not.
We don't want that.
Yeah, it can alter the DNA even.
Oh,
I
can
read.
it? This is why I have to know you guys. Like I'll like do quick research and be like, okay, this is a good one. Yeah, this is a good one. She will delve further, and if I ask her to, she'll be like, here's a list of references. Like she's very factual based, and I love it because I'm like, yes, okay. She's like, I'm gonna expound on this. Love it. This is why I have Delana.
It drives the point home.
It does. It really does. So
Like,
I like it.
crap.
I like
It's
it a lot.
gonna screw with my kid's DNA. Yeah. So cell membrane damage, DNA damage, disruption of cellular metabolism.
Let's not disrupt our fetuses cells. We like to keep our fetuses with happy cells.
Feedi.
This is a fun one. This one's a fun one to say. Yohimbe?
Yohimbe.
Yohimbe. I know this is
And
also...
to me, it's from a plant that is native to Africa, and that's exactly what it sounds like.
That's what it sounds like. Yep. And I think they've used this. They've used this in other things too. But yes, so this is one that helps with athletic performance. This is going to be in like your performance boosters, athletic enhancing drugs, like if you're trying to lose some weight, get your body revving, things like that. Even if you're like, okay, I'll just take one. I'm kind of tired today. Like, it's just been a hard pregnancy. I'm a little sleepy. I'll take one. I know it gives me some energy. Please don't, because it can cause heart attacks and seizures, especially if you're already a hypertensive, high blood pressure patient, and then you're taking that on top of it. No, we don't want any of that. No heart attacks or seizures for you or your unborn baby. So
I'm going through the list, and keep thinking, oh, that one's the worst. And then I go further down the list, and I'm like,
oh no, that one's the worst.
We're going up. We are. We are raising the bar.
Yeah.
And in comes Pennyroyal.
Oh, yeah.
That was one I didn't know.
She sounds so nice. Pennyroyal.
She does.
She sounds so sweet.
And kind of fancy.
Yeah. So that's used, also, I've seen it in tea, used as an antispasmodic for like your bowel issues or for your lots of coughing. It kind of helps relax those smooth muscle tissues. Also, if you're having a lot of like cramping, pain reliever, that's great. Yeah, that sounds good. Especially if you're in your pregnancy and you don't want to take pain meds because you might think a pharmacologic agent like your over-the-counter pain meds might disrupt. Mm-hmm. Well, this can be even worse. This can cause organ failure and miscarriages. And it can be very, very unpredictable. Like the plants can be very toxic or not very toxic. So again, you don't know what plants you're getting, what plants they're harvesting, because there's no way for them to measure the lethality, I guess, if that's a word, or toxicity. Did I just make up a word? I don't know. But yeah, it's very lethal. Very unpredictable. So you don't know what it can do.
And as I was reading, I found that actually in folk medicine, it was actually used for that purpose to induce abortion.
Yes.
Oh, it's terrible. But, and yeah, it like you said, it sounds so innocent. It's a mint plant native to Europe, North Africa, and the Middle East.
That's why it's so great in tea.
Yeah, it's great.
It's wonderful.
It's not
in tea.
great.
It's not great.
Not great. Don't fall for it.
Especially for pregnancy, so please don't. But yeah, a lot of these I was reading too, like they are used as an abortive agent. So in those particular cultures, if or to induce menses, to induce a period, whether there's anything there or not, they don't know. That's what they would use to initiate all that. So
crazy.
Black and blue cohosh. Now these, I know they have the same last name and different first names, but they do different things and they do work differently. Which I've never used these or.
Me neither.
But I think
I'd heard of it.
Yeah.
I don't know.
Yeah. So black cohosh can be used for sore throats. Also helps alleviate menstrual cramps, but also stimulation of labor. So I've heard that some people in conjunction with the help of their healthcare provider have used this to say, okay, well, I'm in like my last 2 weeks. Let me go ahead and just take a little bit of this, see if I can stimulate the labor.
No.
So,
and then you read the words, maybe toxic.
Maybe toxic to the fetus again, because why? There's no FDA regulation. How can we test this?
I really have to question the OB
Yeah.
that
I know.
suggests that.
I know.
I hope none of ours would.
Yeah. So those are uterine stimulants. They can be used, just if you're going to use one of those, please talk to your OB. Maybe they'll say, hey, take it at the end of your pregnancy or whatever. But there's also one I didn't put on here. I don't think I did. But it's, I think it's red raspberry leaf. Now, that's a tea that a lot of people use. And so far, like, I've not seen anything super negative about it. But a lot of people do use it to soften their cervix.
Really?
Yeah.
Interesting.
Yeah, I've heard that many times. So if you're taking it and it's like mid-pregnancy, early on, don't do that. I know red raspberry sounds delicious, like it's going to be a fun flavor, but it might soften your cervix. And
just go get a snow cone if you want the flavor.
So yes, that one I've seen used before. So, but again, a lot of these are dilators, your stimulants, it puts you into labor or kind of forces you to miscarriage. So don't want that. This one I'm completely unfamiliar with.
Me as well. Feverfew.
Feverfew. That doesn't even sound like I want to take that.
No, it sounds like medicine. It doesn't sound like anything that might be, fun or soothing, or
No.
it sounds like something you take when you really feel like crap.
Yep, and that's, I guess, what it does. So
I
it's
mean,
supposed to be a pain
let's see.
reliever, an analgesic. Also read for migraine prevention, arthritis, digestive issues. Like people take it in teas for that or supplements for that. So,
And here we are again. Stimulates uterine contractions. Maybe toxic to the fetus.
maybe toxic to the fetus. Again, we don't want that.
Absolutely not. And then we move on to the one that we see a lot.
Okay, guys, I'm about to get on my soapbox about this one.
Yes. Here we
Delaney
go.
already knows. This is my soapbox. So I did
feel
leave,
it. We all feel it.
I did leave this one last. Okay, I feel like it's so understudied, and it's so readily available. Like all these supplements, you can go to the store and be like, oh yeah, Pennyroyal on the tea, I'll take that. Passion flower, heck yeah, that looks delicious. Look at the pretty pictures. But as many states are trying to like legalize THC products, and I'm not saying THC, don't come for me on that just yet, but as we're trying to legalize these types of products, again, they're not regulated, and now we're just trying to pick apart these substances to see what they can do. And with that, we're trying to do dangerous things with them. So your CBDs, your Kratom, and your Kava. So we use that for pain and nausea relief and sleep. Okay. The biggest one is a lot of people, instead of wanting to take, say, if you've had chronic pain, you're taking hydrocodone as prescribed by your doctor, and you decide you want to stop that and take a Kratom-based supplement because it's an opiate receptor agonist. Yeah. So it's going to bind to those pain receptors to tell your body, hey, I'm no longer in pain anymore, so this is nice. Okay? However, it is disrupted to the blood flow, to the placenta, and can lead to developmental issues when you have a fetus who's been
exposed.
Yes. Well, if
repeatedly.
it's inhibiting the blood flow, you're not getting the oxygen and nutrition. The baby's not getting what it needs. So, yes, we don't know what is deficient about. I'd almost rather you do other things. I don't know. But so here's my soapbox about that. So a long time ago, before this was really talked about, Kratom was kind of still very new, and it was before the THC products were really being sold on every corner. Okay?
Right.
So the Kratom, which is the one we just talked about, is an opiate receptor agonist. I had a mom that was taking Kratom instead of her hydrocodone. She thought it would be natural. She thought it'd be better for the baby. Bless her. She was really trying to do what was better for her baby because she thought the hydrocodone would not be very good. But I'll tell you, a lot of your pharmaceutical medications, not a lot of them cross into the placenta. Okay? Now, this baby ended up in the NICU for weeks withdrawing in so much pain. This poor baby. If mom would have been just taking her hydrocodone, we could have given Number one, it wouldn't have withdrawn so long. Number two, we could have given it some sort of agonist to help alleviate its pain. But we had nothing to give it. Nothing could help it because it didn't do the same thing as the Kratom did. So when this mom kind of realized what had been happening and why her baby had been having these symptoms, even though none of the nurses, the neonatologists, no one could really figure out what exactly was going on, what this baby was withdrawing from, the mom finally admitted to her spouse and said, hey, I've been drinking this Kratom tea. And it created a completely intimate disruption between that whole family dynamic. But more importantly, again, I don't know what developmental delays the baby will have, if it has any, but for weeks we had to watch this baby suffer. Everybody. Because, I mean, it got to the point where that baby had to be like in a low stimulus like sound machine room by itself, just calm, like don't sudden noises, because nothing would soothe it. Like, and we've got plenty
These
of
babies
things.
are miserable.
Yes, they are. And
when they're withdrawn.
yes, and
like,
if we're gonna take
it's sad.
hydrocodone or something prescribed by a doctor, like maybe the withdrawal might take 2 days,
Right.
2 to 3 days, if
And
that.
typically it doesn't require
No.
NICU admission.
No.
Because we do see this.
Yes,
But we've had a few babies
and we've learned.
with extended stays in the NICU.
Gosh, yes, and it's a lot of the times it's because of medications and substances like these, because we don't have the agonist medication to be able to work on those receptors to help your baby. So it's not. I'm not saying you're a bad mom if you take these things, but if you have been taking them through your pregnancy, and then maybe you're just learning about this, or maybe you just read it, still talk to your doctor. If you're open with them and say, hey, I didn't know this was a big deal.
Right.
Here's what's going on. Here's what I've been taking. They will work with you. They will
Because I really
help
think
you.
everybody that's taken it has no idea.
No.
Because it seems so safe.
Yes.
You know, and they have these,
Yeah.
you know, places that you can just 18-year-olds and up can walk into and buy this stuff
Exactly.
and sit there and
Yes.
drink like it's a non-alcoholic bar. And it's not as
wild.
safe
No.
as,
There was one down the street. And
as they tell you it is.
I do go get my dog her little edibles because she's a highly anxious dog, especially if I'm, leaving or living or breathing. She's just an anxious little dog. But so I went to go get her some CBD supplements. She's also on, got little bad hips. So, and I saw Kratom, and I asked the person, I said, do you sell this a lot? And they were like, no, not really. And I said, have you ever sold it to a pregnant person? And they were like, actually, no. And I'm like, good, don't. They didn't ask why. They're just like, okay, get out of my shop, crazy lady. But it's just, honestly, I don't think there's really any withdrawal effects from just THC itself.
And
but,
just so you get a picture of when we're saying babies withdrawal, the symptoms that we watch them go through are just so sad. Like they have trouble, when they actually get some food in their belly, they're spitting it up. They're having
diarrhea,
horrible diarrhea,
loose stools, fevers.
Yes.
Nothing can make them feel better.
Respirations are high. They're just crying constantly. They're shaking. They're very jittery.
Or they're really tense. Like they can't relax. So it's that kind of withdrawal, arching, that kind of stuff. They're crying so hard and they're hurting so bad that everything is tensed and arched up. And it is heartbreaking when you can't console them.
And it's truly kind of like when you watch a movie and somebody's, in a rehab for detox, and you see what they're going through, and they're crying and they're sweating, and that's exactly what the babies are going through. Except they can possibly not. I mean, they have no mental. They don't know what's going on.
They don't know what's going on.
They just
know that they hurt.
Know that life sucks.
They hurt and they should cry, and it doesn't. And I feel like as mother-baby nurses, we're pretty dang good at learning to soothe and swaddle a baby. It's not that. Don't say, just pick it up. Just swaddle it. Just put it skin to skin. No. No, you can do all those things. You can go do all those things together. You can do all those things for hours at a time. It is not going to work. They are just in miserable, miserable pain. So, anyway, that's my soapbox, guys.
Yes.
So
please don't do that. If you have been doing it, now's the time to just change. Education is everything.
yes. And like we said, if you go to your obstetrician
Talk
or
to
your
your
doctor
doctor.
and say, hey, I looked this up and this is what's going on and I've been taking this, what are my options? They can help you through that. They can say, well, let's put you on a different medication.
Yes.
Are you hurting? Why have you been taking this? They'll find the root and the reason as to why you sought out that supplement.
Yeah,
And
some people use it because they think it's a step down from something they've been addicted to.
narcotic pain medicine.
But there are actually other medications that they can give you that are safer for the baby.
Safer for the baby, yes.
So,
And I think that's the biggest thing is any of these, obviously for the previous ones, we don't want you miscarrying or stimulating early onset labor. But also, when you've watched babies withdraw from various substances, if I could only like go back 9 months prior and tell that mom, hey, this is what this is going to do to that baby. So respiratory depression, a lot of them can cause that too. Like they end up maybe in the NICU because they come out, their lungs are immature, they're not breathing as they should, things like that.
Yeah.
So
it's very sad. So hopefully we're here to help you.
And I will say withdrawal from substances, that's a completely other topic. It really is. Like different substances will cause different responses, some more severe than others. And obviously, since every human's different, it may be worse in some babies than it is in other babies. So I feel like at this point, reach out to your doctor. Sometimes I do feel like natural stuff is good, safe, whatever. But when it comes to your baby and this stuff is not studied ethically, they don't want to study this as well. It becomes an ethics issue.
Yes.
Then I would just stick to the stuff that's known.
And, when it comes to like, if you're embarrassed or ashamed because you've had some substance addiction in the past and you think you can just use this and hide it and everything will be fine. We have patients all the time who have histories of addiction, and we don't judge.
Yeah, I'm not going to judge you for that.
We don't ever. Just talk to your doctor and, do what's safest.
Honestly, as your nurse and your baby's nurse, I'd rather you tell us the truth. Like, hey, I had a history of this, this, and this. I found out I was pregnant, and I stopped it. And we'll be like, great, good for you. You're doing the best that you can for you and your baby right now. What can I do to help you? I'm not going to be like, oh, she had a history and she stopped and she found she was pregnant. We should call CPS. No,
we don't do that.
I don't want your baby to go to CPS, like, unless it's absolutely necessary and think I'm going to harm your baby or that you're going to harm your baby. But they've got too much going on and it's too much. So again, just like Delanna said, we're not going to judge you. It is not our job to judge you. It is our job to take care of you and your baby. So.
And if you're trying to overcome an addiction and you're talking to your doctor and doing everything, the right way, kudos to you.
Yeah, absolutely. I mean, everybody has problems. Everybody's different. So be open with us and we'll be open with you for sure.
Absolutely. So,
well, I will
just
say,
be safe.
Let us know if y'all have any experiences with any of these things. Leave us a comment, send us a message. Like it's good for us to know too, so we can educate ourselves and our audience as well.
Exactly. There's probably a lot of things out there we hadn't heard of.
There's so many. I just hit the basics because I figured people didn't want to sit here and listen to me talk for 4 hours about plants and supplements, but. Anyway.
Yeah.
So. Yeah.
So we'll stop now.
Yeah. I will say, I'm going to leave it on this note. I do want to say something about the river.
Yes.
I do want to say something about there. Okay. So I know this is a somber wrap up, but Delanna and I were talking. We just want to say that our hearts do go out if you've been following the Texas, the Kerrville, the Kerr County floods, the Guadalupe River floods, all the people missing, the girls, the family members, the counselors, the rescue teams, that anyone who is helping, the volunteers, we just want to shout out to anyone who's tried to help and whatever. But our hearts go out to those families and that are suffering at this time. Like it's so devastating. Honestly, I'll look at the news every single day and I see it and I'm like, my heart shatters every single day when I see these things. So our hearts out to those families and those poor kids. So
yeah, it's going to be a long road. So
all right, well, thanks for sticking with us and we'll be back next week.
Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.